Now, judicial hanging. This is official method of execution of the capital punishment, and usually it is to the majors, that the adults, for any crime which comes under the execution of judicial hanging. The face of the individual is covered with dark mask. He is made to stand on a flap door which opens downward, and with the pull of the pulley, the doors will open down and the person will fall. And this is the ligature. It does not slip, it doesn't slip, it doesn't tighten up with the fall. They just put the ligature at the angle of the mandible, right or left. They put the ligature, the knot, at the angle of the mandible, right side or left side. So with the fall, violent jerk of the head to the lateral. If it is in the right, it will be toward the left. So violent jerk by putting the knot at the angle of the mandible laterally will fracture and dislocate the upper cervical vertebrae and lacerate the spinal cord. So the rope is tied around the neck with the knot under the angle of mandible, and the drop is approximately 5 to 7 feet. And for the drop level, they measure the weight of the individual, and that's how they determine how much fall can cause the fracture. It is their experience, because the head should not decapitate. The fall should be not be more than the limit that it decapitates the head. Only the fracture dislocation. So usually it is 5 to 7 feet drop, and this length is determined by the weight, age, and build of the person, so that the only it causes the fracture dislocation of the vertebra, not decapitation. So this is how it is. It is a well having the doors which open downward, and with the pull of the lever, it opens up and the person fall down. So when the lever is pulled, the body is dropped down to the length which is permitted, and there is fracture dislocation. So sudden stoppage of the falling body and will cause violent jerk, and that will cause dislocation and fracture of the upper cervical vertebra and lacerate the spinal cord. This is the level C2 or 3 or C3 or 4, and sometimes it is higher, C1 and 2, and the second vertebra will lacerate with the Lantois process. Sometimes the pons and medulla, because of the pull, they are injured, and death is instantaneous. Death is instantaneous, and heart may continue to beat for 10 to 15 minutes. This is the video of the execution cell. The rope is tied above to a hook in the roof. And this is the well. This is a dummy execution with the dummy. You can see the dummy is placed on the flap doors, and that is the lever which is will be pulled, and they will make sure that no one is on the doors. With the pull, there is sudden drop.